Hi, I'm Mike.
And I'm Cole.
We're going to tell you a little bit about the patient that we had that you'll see in the video. Her name is Jean. Jean is an 81-year-old female. She was brought to the emergency department at St. Mary's Hospital due to slurred speech and left-sided weakness. She underwent a craniotomy with hematoma evacuation 2 days post-admit. Transferred to Gaylord Rehab after 4 days of admission.
So the past medical history is she has hypertension, lipidemia, as well as osteoporosis. She was a smoker. Excuse me. She smoked 2 packs a day for the past 10 years, but quit around 7 years ago. She currently lives with her husband of 60 years in a ranch-style home. There's 2 steps to enter with 1 rail on the right side. Seasonally, they reside in Florida during the winter months in a second-floor condo without an elevator. She is also a retired dietitian. Her future plans for OT is to return home in Connecticut, and she has a supportive family, but they do not live locally. So her goals are to return home.
So what you'll see throughout the video is Cole and I doing different interventions and using preparatory methods to reach different goals. All right, thanks.
Good morning, Jean. My name is Cole. I'm going to be your occupational therapist for the day. This is Mike. He's going to be assisting me today. He's also an occupational therapist. How are you feeling this morning?
Pretty good.
Pretty good? Okay, so today what we're going to do is we're going to work on bed mobility, specifically edge of the bed, and we're going to do some reaching activities to strengthen up our core. Okay, how's that sound? Sound good? All right, so first things first, we're going to get you out of bed. So I'm going to ask if you can take your right arm and grab your left arm and bring it up towards your chest for me. Perfect. Just hold that there. And then can you bring both of your legs up and bring your heels towards your bottom? Can you do that for me? Can you bring that leg up for me? Perfect. A little bit more. All right, excellent. And next I'm going to have you rotate your body towards me and make sure your body is on your side. So don't go forward. Okay? All right, so on 3. 1, 2, 3. Perfect. How's that feel? Good. All right, so next we're going to have you kick your legs off slowly off the edge of the bed. So now I'm going to ask that you use your right arm and push up off the bed and bring yourself up into a seated position. On 3, ready? 1, 2, 3. How does that feel? Feel comfortable?
Yeah.
All right, perfect. All right, so just stand right there. I'm going to put the gate belt on you for safety. You still feeling okay?
Yeah.
Not dizzy or anything?
No.
All right. And now we're going to have Mike come over here. And what we're going to do today is we're going to work on reaching directly in front of you. So I'm going to be seated right here, stabilizing your torso. And if you could just use your right arm and make sure your left arm is at your side. Perfect. And if you could reach forward with your right arm and grab all the cones for me. And just set them down your side, on your right side. Perfect. Do you feel stable at all? You feel a little wobbly?
Yes.
Now we're going to have you work a little bit more and reach a little bit farther out. I'm going to be supporting you so you won't fall at all. We're just trying to work on your muscles and your core and your back. Make sure you stand and have proper alignment posture. Reach forward for me as far as you can. Perfect. And then come back up. Good. Perfect. Last one, kind of far out. Forward. There we go. Bring your body up, up, up.
Good job.
Perfect. You feel uncomfortable, unsafe at all?
Um,
Leaning forward, or felt your body was out of alignment? A little wobbly. I felt you were a little wobbly.
a little wobbly.
All right. Well, perfect. So just for a safety precaution, I don't want you to do anything into the bed by yourself at all. Make sure that there is a therapist here. We don't want you to fall. Okay. So now I'm gonna get you back into bed. So if you can grab your left extremity for me so we can get it out of the way, and then reach over towards me with your right arm and place that on the bed. Slowly come down. Perfect. And then can you bring your legs up onto the bed for me as best you can? All right. And then I'm going to have you roll over onto your back. Can you do that for me? Perfect. Are you comfortable? All right. Perfect. Well, thank you.
Thank you.
Now that you're back in bed, I'm going to have you have a home program for you to do the next couple of days until you see me again, to work on your core and to work on your back muscles in order to strengthen your core so we could do edge of bed mobility better. And then the next time we're gonna have you reach down and then to the side and rotate it. So when you're laying in bed, I'm gonna ask that you just work on bringing your hips up to the ceiling as best as you can. Hold that for about 5 seconds and bring it back down. If you can do like, I would say 10 sets of those, maybe 3 or 4 times a day. Good. And then can you bring your butt down as well? 10 sets.
Just like this.
Yeah, perfect. And I'll show you right now. So if you can just hike up your hips to the ceiling, hold that, and then down. Again. Down. Perfect. So just like that. And then the other way, can you bring your hips down towards the bed? Perfect. Up. Again. Perfect. Got it? Does it make sense?
Yeah.
All right, perfect. Well, thank you.
Thank you. What's wrong?
Hi, Gene. How are you today?
Good. How are you?
Good. My name is Mike. I'm going to be the occupational therapist today.
Okay.
How are you doing?
I'm doing pretty good.
Good. What are you reading?
Just
Okay. Okay. Any good sales?
not that I see yet, but still just looking.
Okay. So let me give you a little bit of insight on what we're going to do today. So we're going to use that extremity, your left side, and we're going to work on stabilizing with that side so you can do activities with your other side. So we're going to be working on putting a little bit of weight in that side, okay? Before we do that, we're going to do something called quick stretch or passive stretch. So what I'm going to do, if it's okay with you, is I'm going to work with you on your left side. We're going to do some stretches, then we're going to hold for a few seconds, and we're going to see if we can feel anything or we can see if we increase the range of motion or muscle tone in that arm. Sound good?
Yep.
All right. So before we start, I just want to make sure. Yep. Do it a lot. Good. All right. I'm going to support you on this side. I'm going to take this arm down so we can work with it. All right. All right. So I'm going to support here. And what I'm going to do is I'm going to go like you're doing curls. We're going to do that, and then we're going to hold for 2 seconds. Okay. Ready? 1, 2, 3. Good. How's that feel? Felt pretty good. Okay. So you try and move that for me. Okay. So we got a little bit. That's good. Good. We're going to do that one more time. Okay. Ready? 1, 2, 3. Up. Good. Awesome. I feel a little bit of a contraction there. That's good. All right, so now we're going to work over on the wrist. So I'm going to support you here. We're going to do wrist extension, okay? So I'm going to come back like that. Ready? 1, 2, 3. Out. Good. Now can you try and bring your hand back for me? Perfect. Awesome. We're going to do that one more time, okay? Ready? 1, 2, 3. Back. Good. One more time. Leave that up. Awesome. Now we're just going to do finger flexion too. We're going to do a little wrist flexion. 1, 2, 3. Okay. Good. Now I want you to bring your hand towards your body. Good. Okay. One more time. 1, 2, 3. Okay. One more time. Bring your hand towards you. Excellent. So we have compression there too. Very good. So I'm going to put this down. I'm going to put the arm back. How do you feel? A little tight. All right. Take that from you. Thank you very much. Now we're going to move to the table. So what we're going to do is we're going to practice stabilizing on that arm during the writing activity. Okay? So I'm going to move you over there. Lock these. All right, I'm going to push you right into the table. If it's too close for you, just let me know. Good?
That's good.
All right, make sure these wheels are locked. Awesome. So the activity that we're going to do is we're going to do a little bit of writing. What I want you to practice doing is taking that side with your right hand and placing that hand, up there, and I'm going to support here on the wrist and on the elbow, just to make sure I want to see how much you're pushing down on that paper, all right? And I want you to write 1 or 2 words, and then we're going to work on placing it back, and then we'll go from there, all right? Okay, so please, I'll help you come back. All right, ready? So let's take that hand, put it up. Yeah, good. Put a little bit of weight. Shift your weight into this arm. Okay, now I want you to write 2 words, whatever words come to your mind first. All right, now put the pen down. Okay, now I want you to take your hand with your right hand, pick it up, put it back into your lap. Excellent. All right, what do we have? Oh, you have some pretty good handwriting. All right, we're going to do that same thing again, but this time I want you to write a full sentence, okay? All right, so pick it up on here. And let's see it. Okay, put the pen down. And same thing, move this extremity with your right hand. Yep, pick up, down onto your lap. Excellent. This activity is so much fun. Oh, I'm sure you say that to all your therapists. All right, so how did that feel?
That felt good.
Good?
Yeah.
Did you feel like you were putting any weight in that extremity?
I felt like I was putting a little bit of weight in it.
Okay, and how comfortable was that?
It felt a little awkward, but I really enjoyed writing. So
Okay, so good.
definitely something I love with.
Awesome. Good. So as we go on, hopefully we can improve that. When we start getting a little bit better at it, I'm going to have you start writing a little bit more than one sentence. Another thing that I'm going to work on with you is maybe taking this arm down so you have to put a little bit more weight on the paper. Sound like fun?
Yep.
All right. What I have for you over here, let me just grab it for you, is this nifty little worksheet for like a home program. Okay, so these are some exercises that you can do at home.
Okay.
So let me just show you what we got. So we did the writing. You have some mealtime stuff, so you can work on passive stabilizing at mealtime, during bathing, or when you are brushing your teeth. Okay, so those are some exercises you can try at home. The person in the picture has the opposite side, so just when you're looking at the arm, that's the arm that's less stable. Okay. Other than that, I think we're good. Just some safety precautions. I'm sure you know most of these, but I just want to go over them with you quick. Just make sure you only go so far. Don't try and get crazy and challenge yourself. Just make sure you're doing stuff that you know you can do, because you're a little unstable on that side. So, we don't want you to fall or anything like that. Do you have someone at home that you live with that helps?
My son.
Okay. All right. Perfect. So, absolutely, when you're doing these exercises, you might want to do them in the wheelchair where you have some support. Well, I think it'll be good, all right?
All right.
All right. Well, it was a pleasure working with you today.
Thank you. Thanks for